Hello everyone and welcome back to the channel. Today we are going to talk about acute kidney injury, or what is often called as AKI. Unlike chronic kidney disease, which develops slowly over many years, acute kidney injury happens suddenly. Sometimes it can develop over just a few hours or a few days, and when that happens, it can be very serious. In this video, we'll walk through what acute kidney injury is, how is it different from chronic kidney disease, what causes the kidneys to suddenly fail, the role dehydration and infections play, what recovery looks like, and most importantly, how can acute kidney injury often be prevented. So let's start with the basics. What is acute kidney injury? So AKI, or acute kidney injury, means that the kidneys suddenly lose their ability to work properly. Normally, your kidneys filter waste from your blood, balance fluids in your body, and keep important minerals and electrolytes at safe levels. But during acute kidney injury, this process slows down, or in severe cases, it can stop altogether. When this happens, several dangerous changes can occur. For example, waste products build up in the blood, extra fluid stays in the body, and salts and minerals can rise or fall to unsafe levels. AKI often develops during a serious illness, after an injury or surgery, during severe dehydration, or in the setting of severe infection. Because it happens quickly, acute kidney injury usually requires urgent medical attention. So what's the difference between acute kidney injury and chronic kidney disease? Acute kidney injury and chronic kidney disease affect the same organs, which are your kidneys, but they are very different conditions. In acute kidney injury, the damage happens suddenly, often triggered by illness, infection, or injury, among other factors, and can be reversible if treated early. On the other hand, chronic kidney disease develops slowly over months or years, causing permanent damage and usually requires long-term care. A simple way to look at it is AKI is a sudden shock to the kidneys, while chronic kidney disease is kind of a long-term wear and tear. The good news is some people may recover fully from AKI. Others may be left with weaker kidneys and a higher risk of chronic kidney disease later on. So what are the causes of acute kidney injury or sudden kidney failure? There are many reasons why the kidneys can suddenly stop working. And common causes include severe dehydration, for example, when somebody is having profuse diarrhea or vomiting. Heavy blood loss can also cause acute kidney injury. Major infections like malaria can cause acute kidney injury. Heart problems, especially acute heart failure that reduces blood flow to the kidneys, can also cause acute kidney injury. Certain medications, even if taken over the counter for a short period of time, like painkillers and antibiotics, can cause acute kidney injury. The dye that is used in some imaging, like CT scans, can cause acute kidney injury. And even blockages in the urinary tract can cause acute kidney injury. In many cases, acute kidney injury happens because the blood flows to the kidneys drop suddenly. Without enough blood and oxygen, the kidneys cannot do their job. This is why AKI often occurs in people who are already very sick or hospitalized. Two of the most common triggers for acute kidney injury are dehydration and infection. And these are very common in our setup in Kenya as well. With dehydration, the body doesn't have adequate fluid. So what happens is the blood pressure drops and the kidneys don't receive enough blood or enough perfusion to actually function properly. With severe infections, which leads to sepsis and septic shock, whereby your body's blood pressure tends to drop, the body's response to infection can disrupt the blood flow, leading to widespread inflammation and can also damage the kidney tissue. As I mentioned, the blood pressure may fall to dangerously low levels, and this leads to reduced perfusion. And this is why symptoms like prolonged vomiting, diarrhea, high fevers, or anything that is suspicious of serious infections should never be ignored, especially in older adults. So what are the signs and symptoms of acute kidney injury? The symptoms of acute kidney injury can vary from person to person. Some people may notice very little urine, or sometimes they just stop producing urine at all. Some people produce very dark or concentrated urine. Some people tend to develop swelling in the legs, ankles, or the face. They develop shortness of breath now because of the fact that fluid is accumulating in the lungs. They develop extreme fatigue as well. And when the toxin levels accumulate in the body, it can lead to confusion or difficulty concentrating. Some people can get nauseated. They have loss of appetite. It's important to know that acute kidney injury doesn't always cause obvious symptoms. Sometimes it is only discovered through blood and urine tests, and that is why early testing during illness can be life-saving. So can someone recover after acute kidney injury? And the answer to that is yes. Many people recover from acute kidney injury, especially when the treatment starts early. Recovery depends on several factors. One is what caused the injury, how quickly treatment began, and the person's overall health as well. Some kidneys can recover fully and return to normal. Others recover partially and remain weaker than before. In severe cases, acute kidney injury, especially if it is not picked up early and the treatment started early, can lead to chronic kidney disease or long-term kidney problems. That is why follow-up care after acute kidney injury by a nephrologist is extremely important, even if you had full recovery of your acute kidney injury. So how can one prevent acute kidney injury? Many cases of acute kidney injury can be prevented. Key prevention steps include staying well hydrated, especially during illness or hot weather, treating infections early, seeking medical care early when you suspect that you have an infection, avoiding over-the-counter medications, monitoring your blood pressures, avoiding unnecessary use of painkillers, and informing doctors if you already have kidney problems and having regular blood tests if you are at high risk. Prevention is especially important for older adults, people with diabetes, heart disease, or pre-existing kidney conditions, because they are the highest risk of developing acute kidney injury. So in summary, acute kidney injury is serious, but is often treatable, reversible, and we can prevent it. Knowing the warning signs early, acting early, and protecting your kidneys during illness can save your kidney function and can save your life. If this video helped you, please like, share, and subscribe. Early awareness truly makes a difference. Thank you.